Thank you. Well, nice to see you all. And without any further ado, are there any particular welcomes today? I'm aware that press is here today. Arlene, is that correct?
Yep, that's right.
Okay. Thanks very much indeed. And any apologies for absence?
Okay, so can I just remind everybody that the meeting's being recorded and will be placed on the websites for public viewing. And Bob will now take a roll call for the minute.
Thanks very much indeed.
Okay, Bob Benson.
Present.
Councillor Toland.
Here.
We've had apologies from Councillor McHugh. Bailey Wright.
Present.
David Cheap.
Present.
Dave Berry.
Present, Arlene.
Justine Jones.
Present.
Sanjay Pillai. Glenn Lloyd.
Present.
I've had apologies from Jocelyn Lyle. Barry Hudson.
Present.
Raymond Marshall. And I've had apologies from Martin Sloan. Will I just carry on with the agenda, Chair?
Yes, please.
Okay, so the apologies have been noted. Item 2 is declaration of interest. Are there any declarations? No. So that takes us on to item 3, which is the minute of the previous meeting held on the 25th of September, which is submitted for approval, and the action tracker.
We just take that as the minute. Do we take the minute to be approved? Unless there are any corrections to it for those who were present at the meeting. Okay, the minute's approved then. In that case, can we go any reference to the action tracker then on 3V? Who's going to speak to that?
Sorry, Bob, I'll just kind of a brief overview. As you can see from the action tracker, quite a number of the outstanding actions have kind of now moved to green, so they'll be kind of taken off the tracker from future. We do have a couple of other ones that are in progress, and as you can see, there are kind of revised dates for those kind of set out within the tracker itself. I think most of them are sitting in January. Yep, I think they're all sort of kind of January time. So that kind of should bring us quite kind of up to date in terms of the actual outstanding actions, which will be quite significant progress that we've made over the course of 2024 with these actions. So happy to take any questions.
Any questions? Don't see any questions. Just in terms of item 5, revised pack terms of reference, that's coming to the IJV in December, Dave. Just out of interest for the timescale of things, in 2025, is there a formal review of the integration scheme?
So the scheme itself will not. The scheme itself won't kind of go in 2025. The work will start to commence in 2025 around the review, but I think it's the year. I think it's the year after that it's actually due to be resubmitted, if you like.
So the kind of consultation work would happen in 2025, presumably.
Yes, my understanding. We need to kind of link in with the statutory partners around that, because it's actually them that will lead the integration scheme itself, and we will obviously contribute to that, but it's their scheme. So, but we have, it has been kind of noted that it's on the horizon from their perspective.
It feels like such a short time since the last one, I have to say. Thank you very much indeed. Okay, unless there are any further comments on item number 3, we'll now move on to item number 4, which is the Protecting People Committee Annual Report 23-24. And a welcome to Elaine Torrance, who's the independent chair. Elaine.
Thank you, and thank you, Chair, for that introduction and for the opportunity to introduce this report. So for those of you that haven't met me before, I'm Elaine Torrance, and I'm the independent chair of the Children at Risk and the Adult at Risk committees. If those of you that have been talking about public protection for some time will notice that's changed slightly, because we've changed our structure slightly. So we now have a Children at Risk and Adult at Risk committee, which incorporates violence against women and suicide prevention. And that's our work to work together in a much more joined up way around our public protection, and hence the report today, which is covering all the elements of public protection, and hopefully that's useful to you, so you can see it all as a whole. So I'm delighted to present the Protecting People Annual Report. It runs from April 23 to April 24. And I'm presenting it really on behalf of all the independent chairs, because not just myself, there's Pam Dudek, who chairs the adult, the ADP, and also we have our Violence Against Women champion that is also Anne Hamilton, who also helps us a lot with this agenda. So there's a number of us independent chairs who work together. There's no statutory requirement to publish a report apart from the Adult Support and Protection Committee, and that needs to publish a biennial report every 2 years, and it is our 2-year reporting cycle this year. But we feel that it's really important that we produce a report, and we advise of the work that we do publicly, because there's a lot of excellent work that goes on throughout the whole period, and also to let people know about the work that we're going to be doing into the future. So we're delighted that we've been able to produce this report, and that we're able to present it today. It's the second integrated report, which consists of a main report with key data, achievements, challenges and future priorities, plus it has an accompanying information document. And I'll just summarise a few points from the report, but happy to take questions at the end. So, as can be seen in the report, there's been significant progress working across the committees, that cross-cutting approach that I talked about earlier. So the development of a Protecting People learning and organisational development framework, our training framework, working together. Learning review, we've published a new learning review process, and we now have cross-cutting learning reviews that work right across all the committees. And we've done that jointly with our Angus colleagues as well, so that's a new initiative for us. The report highlights data in each area and progress and challenges and future priorities. So in terms of adult support and protection, you can see an increase in referrals in the report, and there's a sort of graphic there that highlights some of the key data. The main types of harm are welfare concerns and financial harm. And you can see there where we do progress to formal investigation under the Act, adults with learning disabilities and people with mental health issues are the ones that we take forward the most. In terms of child protection, there's over 2,300 police concern reports, but the reason I think I mentioned that is that there's frequently reported concerns about domestic abuse, mental health and parental drug abuse, which absolutely links across the areas that we need to focus on and reflecting the need for more joint working. The domestic abuse figures remain high. They always have been in Dundee. They'll continue to be so, but we try and work with to reduce those. And interestingly, the refuse requests increased by 49%. Suicide prevention is now a key focus in committees, and we've got a new worker in terms of taking forward suicide prevention, and we've also published a new plan recently as well for that. In terms of drug and alcohol, you can see there 30 drug deaths and some 36 alcohol deaths. And again, the age range for drug deaths, 45 to 49 being the most prevalent, but very clearly links with our very, very deprived areas in the city. There's a number of progress areas that we've highlighted in the report. So we've worked very hard to improve our work with older young people. That was following some inspection and learning review work that we did. We've been redesigning our adult at risk pathway in terms of adults at risk of harm. That's actually trying to think about how, when people don't get into that critical legislative framework, how we can actually support them better in a more preventative approach. And in terms of drug and alcohol services, we've made good progress with the medication assisted treatment standards, the MAT standards, and we'll continue to prioritise those as well. We have challenges, though, as all areas have, right across cutting and in some of the significant committee areas. But we are working very hard on embedding the voice of people with lived experience more fully into our work, both at an operation level, hearing back from them about if we've worked with them, has it made a difference in terms of their lives, but also how we do that at a strategic level. And we're working with a project called Authentic Voice to do that. And there's been some progress in the drug and alcohol world in terms of that. And we work in all the committees to try to get that much more front and centre to our work. The learning reviews that we undertake each year, we do look at the learning from those and how we can implement the actions from those. Obviously, that's really important. And in terms of our quality assurance processes, making sure that we can double check the work that we're doing around thinking, for example, about case file auditing to make sure that our processes are robust, and we receive some assurance back around that whole process as well. And managing the public sector financial pressures and insecure funding for the third sector is always a challenge. And there are some current issues currently with the violence against women, third sector organisations who are still awaiting the Scottish Government funding envelope for those. So it does create some anxiety in the situation, but working hard again to try to resolve some of those. And just before I finish, I'd just like to say a big thank you to all our committed staff across health, across the local authority, third sector and our police colleagues. They all work so well together in partnership. There's real good partnership working, and I think that helps us deliver a lot of what we have outlined in this report over the last year and continue to do so. So big thanks to our committed staff who do a fantastic job to keep people in the city safe. So thank you, Chair. That was all I wanted to say, but I'm happy to answer any questions. I know there's some colleagues around as well who can address some of the points as well. But thank you very much.
And thank you very much indeed, Elaine. And greatly welcome this report. It tells us there's a lot of information, a lot of ground covered in it. Can I just ask you a general question before I open it up for any questions, Elaine? Do you believe that there's much more heightened awareness about why abuse happens, which was often very secretive before and people refused to speak up about it? Do you feel content that even if that would create more referrals, that actually there's more likelihood of that happening now, so that increases will perhaps demonstrate better public awareness?
Yeah, I'd certainly hope that was the case. There's been a lot of press coverage, hasn't there, in terms of child protection, and cases that don't go so well right across the UK are well publicised now. So you would hope that people in communities have heard the message that if they're concerned about children or adults who are at risk of harm, that they come forward and report that. And we try then to deal with it very sensitively, obviously, in terms of that approach. But we still have more to do. I guess that some of the cases that do go wrong illustrate that there's still more that we could get in terms of getting involved earlier. And I think the focus that we're trying to do on prevention, getting in earlier is really important. So yeah, I would encourage anybody who's got any concerns, report them through the appropriate channels, and we will take those forward. So yeah, thanks for the question.
It's okay. Thank you very much indeed. Question for Elaine, please.
Chair Siobhan's got her hand up.
Siobhan's got her hand up.
Siobhan Toland.
Toland, thank you. Thanks for that report, actually. I mean, yeah, it makes for kind of some harrowing, but maybe quite hopeful reading. I've got a specific question around gender-based violence. Two questions, if you don't mind. The first one is the IGB dealt with the financial, well, it came to the IGB, I think it was last year, regarding the Shakti Women's Aid and the financial crisis that they were meeting at that point. I just wondered if within the statistics that you've given, or whether you've done any research in terms of the kind of the BAME violence that women experience, of course, because there's kind of, you know, multiple vulnerabilities there. And thinking about that in terms of the precarious nature of the funding that they had. You mentioned, you alluded to that in terms of the Scottish Government funding. So I suppose the point I'm trying to ask is, given that Shakti Women's Aid were so vulnerable in terms of their finances last year, have you looked at the data to see how we can maybe reassess and support those women going forward? My second question, maybe a bit more straightforward, is that I noticed that there was a 49% increase in refuge requests. Could you maybe just explain a wee bit round why that might be the case? Thank you.
Thank you. I might bring Catherine in, actually. She may well know some work, particularly about Shakti, if that's okay, Catherine.
Yeah, that's fine, Elaine. So yes, obviously through the previously the Violence Against Women Partnership and now Adults at Risk and Children's at Risk Committee, there's still development work around data sets and monitoring of demand for services from different groups, and that is part of the kind of breakdown of it, because we're very conscious of the different needs of women from different minority ethnic backgrounds within the city, and we also monitor that closely through some of the information that comes through our MARAC process, which is a case competency process for very high risk victims, and we use that process particularly to respond to issues of forced marriage and honour-based violence, which clearly disproportionately impact on women from minority ethnic communities as well. So I think we do have a good overview of need and demand, and I think in terms of the precarious nature of funding for violence against women's services, I can reassure you that that's been something that's been on the Chief Officers Group agenda very consistently this year, and there's been quite a lot of activity, including Chief Officers collectively making representations nationally about the need to move forward with some of the recommendations from the National Violence Against Women Funding Review, and to look at a more stable approach to funding third sector core violence against women's services moving forward through the national funding routes as well. So we're continuing to kind of work with national partners round about that. So that's that bit. In terms of refuge requests and the increase, I will need to take that off table if that's okay, Siobhan, and get some detail from Women's Aid about what they feel particularly is driving that. Overall, I think we've seen increased demand for services around violence against women following the pandemic. So I suspect some of it continues to be related to that and the particular vulnerabilities of the population in Dundee. I suspect some of it will also reflect challenges in terms of the availability of other homeless accommodation. So perhaps women who might not previously have necessarily wanted to come into a refuge setting, and the lack of maybe access or challenges accessing other homeless accommodation may have decided that that was something they wanted to try as part of their route. But I'll get a little bit of clarification from that from partners at Women's Aid, and we can come back to, we'll send something to all the members of the IGB with a bit more intelligence about what's driving that.
Thank you so much.
You're welcome.
Thanks, Catherine. And David Cheap.
Yeah, thanks, Bob. First of all, Elaine, thanks very much again. I know a few of us attended the briefing last Wednesday on people protection. It was a good chance to look at the report in detail over a good length of time. So I have less questions today. Mine's more of a comment, really. Just having a chance to read through again, and some of the indicators in here are really useful. The way you've got them all set out in the report. But it's more of a comment. You know, I'm fairly new to this still, I still believe, but for myself. But whereas in the past I've kind of looked at these and looked at particularly on perhaps drug prevention, drug deaths and things, my mind looking at this was I was turned more to the suicide prevention element of this, report, a real concern with that, and reading still that the rate of suicide in Dundee is the highest in Scotland. There's clearly a link here when you see that more than half of the numbers that sadly committed suicide were living in more deprived areas. And that's probably no great or new news to people, but there's coming new to this. It's clearly a link there, and looking at the average age of death, it's very similar to the average age of deaths from drug death as well as in Scotland. There's something to be read from all of that. But the other thing was, I was quite interested as well in this one, that it's just over half, however, if I'm right in saying, reading this properly, had actually had contact previous contact with in mental health or been known for substance abuse or whatever. But it's still not as high a percent as I thought might have been, perhaps, that had been recorded. So there's obviously maybe not a significant number, but a significant percentage that aren't known to maybe services. Am I correct in assuming that?
I think that's what the figures indicate. I mean, we are doing a lot of work around suicide prevention, and I think you're right to raise this as an issue. And I think now the committees are taking a focus on suicide prevention, which is really, really useful as well. We do have a new worker in post, and he's just been working on the action plan for suicide prevention, which I think should impact on the figures. The figures, we are the highest, I understand, but you're talking about small numbers, David, there in terms of numbers of people who do commit suicide. But there's obviously work to do. That's highlighting there's work to do in the city. I think that things like increasing our training opportunities for staff so they're more aware. But you're right. If people are not coming into contact with our services, then we need again to be raising the profile of this in communities, don't we? And getting people the right support. And I think there's been such a lot in the press recently about how we should be openly asking people, if they look depressed or they're very unhappy, are you actually contemplating suicide? If you can have that honest conversation much earlier on, that doesn't have to be a service area. That could be a family member. So I think there's a lot that can be done, within communities as well as through services. But yes, I would hope that when we come back with the next report, that we will see some shift in those figures, and the action plan will make a bit of progress in this area, and make sure that there's more training, more communication, and that things are developed in that area. But I'm pleased that you've highlighted that, because it is an area that we would like to be focusing on over the next period.
If I just come back a second, Bob, on it. I mean, thanks, Elaine. And I did read about the suicide prevention officer being appointed, which is great. But there is probably quite rightly so much focus perhaps on drug prevention and drug deaths. But in this report, there's the same number of suicide deaths in Dundee as there is drug deaths. So it should be as an equal ranking, as far as I'm concerned. If that's the level and numbers we're seeing, it needs and deserves more focus. So thanks very much for that.
Thank you.
Thanks very much indeed, Dave. Siobhan.
Sorry, I don't want to dominate the conversation. Just kind of coming in on what you said, there's kind of been, I think, a very good initiative in my ward, not done by me, but by the local community in the Waterbank area. There'd been 2 suicides in the multis, and that had caused some concern. So there was a lot of discussion around that. And actually what's happening now is Penumbra are going to go in and do some outreach work. So it's a small example, but actually a really good example of how on the ground people can kind of help themselves, and exactly as you were saying, kind of have those conversations. I think the meeting was last week, if I'm understanding. Yeah.
That sounds like an excellent initiative. If we can see more of that across the city, Siobhan, I think that will help raise this profile. Thank you.
Thanks very much, Siobhan. I'm not seeing any further questions for you, Elaine. Perhaps the report speaks for itself, as it does, I think. So thank you very much for that. Can we note the recommendations within the cover paper? I won't go through them all, but we do welcome the amount of progress that's been made and the action plan that you've set out, and see further improvements in its implementation, and particularly in that last area that we're talking about, which I think is indeed a very complex area. Thank you very much indeed, Elaine, and we look forward to seeing you again someday.
Okay, thank you very much. Thank you. Bye.
Bye. Okay then, thank you. That now takes us on to the item 5, which is Audit Scotland Annual Report and Integration Joint Board Annual Accounts 23-24, and that's being presented by Christine and Rachel Brown. So, Dave, do you want to come in?
Yes, thank you, Chair. Just before we kind of go on to that item, I'll kind of pass on to Rachel to kind of cover the Audit Scotland's report. We've actually just noticed that the IGB's accounts themselves have been omitted from the supplementary papers that were that should have gone out. So we've got the Audit Scotland report, but the actual accounts themselves have been omitted. So Arlene Hay will circulate the email with the attachments on it just now. However, I'm kind of conscious then that gives us a challenge, because members won't have had a chance to kind of look at the accounts to then kind of approve. So I think if we can let Rachel and Christine pick up on the accounts first, and then on the Audit Scotland report first, and I think we'll have to kind of agree how we want to take forward the actual approval of the accounts themselves then, because we had obviously intended that they would go today, and we're kind of lined up with our Audit Scotland colleagues for signing off the accounts. So if you can, I'll kind of let Christine and Rachel pick up first, and we'll try and work out the next steps after that.
Yeah, thanks, Dave. Yeah, it was just a wee bit of a panic in the last sort of half hour or so, noting that the appendix with the actual accounts document wasn't included with the supplementary agenda that was sent out. So apologies for missing that, and actually apologies again for actually not spotting it until the meeting had actually started. So what I was going to say is I am pleased to be presenting the annual audited accounts for 23-24, and same as Dave's already mentioned, Rachel Brown and her team from Audit Scotland are also joining us on the call today. The actual accounts themselves are generally unchanged, though, from the unaudited accounts that were presented to the IGB back in June. So this, fundamentally, you've seen the document itself and the numbers that were in there, but obviously, we do need to sign off the formal audited accounts at this stage and get these signed off and presented and published on the website. So we'll pick up the actual logistics of how we sort that one out in terms of the meeting process. We've worked really well from our finance team and other colleagues within the Health and Social Care Partnership with Audit Scotland in the last few months, and so we're really pleased to be getting to this stage. And I'm happy with the audit report that Rachel's about to talk to, and I welcome the findings, the recommendations, and the good practice comments that are in it. So Rachel, if you'd like to add any comments and talk us through that, that'd be appreciated. Thank you.
Okay.
Thanks.
Thank you.
Thanks, Christina. Thanks, Chair. There's 2 audit papers in front of you that you're required to consider before you approve the accounts for signing. The first is a cover letter that summarises for you the status of the audit, which is substantially complete, subject to electronic signing of a final set of accounts and your own approval. We say in the cover paper, I'm anticipating signing an unmodified audit opinion. That's an unqualified, clean audit opinion on your financial statements for the year, which is a result that you would hope for and expect, but I would also say is not to be taken for granted. That is an endorsement of the stewardship of public funds that the IJB's exercised in the 2023-24 financial year. And it's testament to the standard of the unaudited accounts and the working papers that were supplied for audit. And we include a specific mention of that in the full annual audit report. We also note that there are no significant findings, there are no significant changes to the annual accounts from those that were approved as unaudited back in June, I'm going to say. Might get dates wrong there. But from that set of unaudited accounts, there's not many changes at all. There's some presentation and disclosure changes that have been made, and there are no unadjusted misstatements to be corrected. I'm required to bring to your attention anything that we think should be amended for your agreement, but there's none of that in this year's set of accounts. I will also pause at paragraph 6 of the cover paper just to check that as of today there's not anything with regard to actual or suspected fraud or any significant matters that would affect the 23-24 accounts that officers or members have not already raised with us as the auditor. I am hoping there will be silence for a minute there, but now is your chance to tell me if there's something that has cropped up since the end of our fieldwork that you feel would affect the annual accounts. And I'm not seeing any hands up, which is good.
Thank goodness for that. Thank you.
Yes, indeed. It's a bit like that point at the wedding where we say, speak now or forever hold your peace. But thank you all for engaging with that. The appendices to the cover paper are the full wording of the independent auditor's report that I'll be signing, and also the full wording of the letter of representation that we asked to be signed and given to us with the audited accounts. So that's the content of the cover paper. I was now going to move on to the substantive annual audit report. This remains a draft until I sign the independent auditor's report in the annual accounts, but it's a final, it's a final agreed draft. There is one change between the version in your papers and the version that will be issued as final by me after the accounts are signed, and that is that recommendation 2 in the action plan has been removed and paragraph 43 has been expanded slightly to put in an update on the progress on recruiting a permanent chief officer following a meeting that I had with one of the chief execs responsible for the recruitment process. So rather than putting in a recommendation, we've just put that information in the body of the report. So the annual audit report that will be issued as final will only have recommendation 1 in the action plan. So I was going to run through very briefly some points. Auditing standards require me to draw certain things to your attention. So I'm just going to run through key sections of the report if you're happy to bear with me. The substantive part of it is the audit of the 23-24 annual accounts, but I'll also draw your attention to paragraph 7, where I confirm we have not undertaken any non-audit work and there's no conflicts of interest or risks to our independence as your external auditor. So we put that in the report as well. I note the unmodified audit opinions on your annual accounts, which is an excellent result, and the good standard of the unaudited accounts and working papers that were submitted for audit. In that first section, we also note for your information the materiality levels that we use for our audit, which is the level at which we would consider it would affect decision making of those using the accounts as the basis of their decisions. We also report on how we have addressed the identified risk and material misstatement that we set out in our annual audit plan, and we have received the required assurances from the external auditors of your partner bodies, and those are also my audits, so I am fully aware of the assurances and the work that's been done by the external audit teams at Dundee City Council and NHS Tayside. We note that there are no significant changes or findings to report to you. We draw out a good practice example. One thing we like to do and are trying to get better at is drawing out where there's good practice in a set of accounts or in the practices of an audited body so that others can learn from it. So we build up essentially a library of good practice that can be shared with others. And I know that chief officers and chief finance officers also talk and network amongst themselves for sharing what's good practice and what's worked in other IJBs. I also note at the end of that first section that all the prior year recommendations from earlier audit reports have been implemented. So again, that's excellent progress there. And as public sector auditors, we don't just audit your annual accounts. We have a wider audit role to comment on financial management and sustainability, about vision, leadership and governance, and about your use of resources to improve outcomes. So I'll just run very briefly through those sections, if I may. In terms of financial management and sustainability, we note that in the year 23-24, you had appropriate and effective budget monitoring and reporting arrangements. We note the financial results in the annual accounts and that were reported to IJB members during the year. So you have an operational overspend at the end of the year after the planned use of reserves. And we have an exhibit there that ties that back to the deficit that's reported in your comprehensive income and expenditure statement in the annual accounts. And we draw out some of the main overspends and underspends behind that financial result also in that section. We note the reduction in your reserves balance because of the deficit on provision of services for the year. And we note the forecast operational overspend going forward. So despite having effective budget monitoring and financial management arrangements, you're still looking at a significant operational overspend and a projected budget gap over the next 3 years. And we make a recommendation in this section, which is a recommendation that I have to say is not just for Dundee. I'm making that recommendation across all of my IJB audits, and it's a national challenge to plan and deliver financially sustainable services. IJBs nationally are facing significant challenges, as are the partners. So when we say, you must implement your financial recovery plan and work with partners and communities to deliver financially sustainable services, I don't underestimate the challenge of that, the collaboration that's needed between IJBs, between the partners, with communities and with the Scottish Government to drive that forward. The Accounts Commission reported on that earlier this year, and we don't underestimate the challenges that provides. But in order to deliver services within the envelope of resources you have, things system-wide will need to change. So that recommendation is made to you and it's made to others across Scotland, I would say. In terms of leadership of the IJB in, planning and delivering services for the people of Dundee, we say that you have a clear strategy set out in your strategic and commissioning framework. You have effective and appropriate governance arrangements that support scrutiny and decision making. And I'm now plunged into darkness because there's a motion sensor in this room. And we also note, the progress, I should say, in arrangements for recruiting a permanent chief officer, as the previous chief officer has now retired, and you have interim arrangements in place which are effective, but we note that we'd expect recruitment of a permanent chief officer to progress, and that's in hand, and I understand an update will come to the IJB in December. The final section of my report is on use of resources to improve outcomes, which looks at your performance management and your performance reporting and your arrangements to secure and deliver best value in your use of resources. So we conclude that following presentation of a best value annual update and the plan to bring that annually going forward, then that you have appropriate arrangements in place to demonstrate best value, and that you have effective arrangements for reporting and monitoring performance, which covers the work of this committee. It covers the management commentary in your annual accounts and public performance reporting through your annual performance report. And we also draw out a further good practice point on the impact that the Hope Point Crisis Centre is having in Dundee. So again, drawing out essentially a case study that others can learn from that's had demonstrable impact in the local area. We have some commentary on your performance in the report, but the main detail of performance reporting should sit with the IJB and what is publicly reported by you. So that's not a particularly long section in my report. And just at the end, there is the Appendix 1 action plan with the one recommendation on service design and an update, a brief update on the implemented prior year recommendations, so that you can see what has been done in terms of clearing those off. So I was going to pause there and thank members and officers for the help and support that my team have received on this audit. I think it's gone smoothly and well from my perspective. I hope IGB officers also feel that. I think there's been positive relationships, albeit robust challenge and independent external audit. But your accounts are in a good place, and the report itself is positive and draws out good practice for others to learn from. And yes, I don't underestimate the challenge that you have in implementing the recommendation that I make this year. So I was going to pause there. My team are also on the call in case there's any questions of detail. So I take questions on the reports or the audit process, and then we can discuss procedures for the annual accounts. But as Christine pointed out, there's no substantive changes from the unaudited accounts, so it depends how comfortable members are with what they remember from scrutinising the unaudited accounts previously. So I'll pause there, Chair. Thanks very much for your patience.
Thanks very much indeed, Rachel. That's very helpful, and it's actually very positive about the work that has happened across the Health and Social Care Partnership and what is brought to the IJV today. So I'd like to note that as the chair of this committee. Are there any questions, particularly on the contents of the report itself? Bearing in mind we don't actually have Appendix 3 itself around the accounts. But are there any questions that people want to raise or points they wish to clarify or indeed to highlight and commend? Dave, thank you.
So no questions on this one. I just like to thank Rachel and her team for the way they've carried out the audit and the kind of the relationship that we've kind of had over the last 12 months. Because obviously, as you can see from the report, and as Rachel said, this is just a bit about the accounts and what happens in it is that kind of a kind of month by month kind of oversight of the activities and of what we do. And I think what's been reflected back in the auditor's report is kind of really helpful for us in terms of any areas we want to kind of look at further. I'd also just want to kind of point out that in terms of the recommendations, noting that there's one recommendation will come off that'll leave us with one recommendation. That's kind of in a different place from where we've been previously, where we've had quite a number of kind of recommendations come through. So it kind of shows the strength of the improvement in the governance processes and other processes we've installed within the partnership over the years. And that's kind of testament to the hard work of a number of people on this call and kind of wider than that. So I'd also like to thank officers from the Health and Social Care Partnership who not just in terms of the accounts themselves, or the kind of the finance team and performance team who pull together the accounts, but also those that have contributed to enhancing our governance arrangements. Big thank you to them. So I just want to say that. Thanks.
Thank you, Dave. David.
Yeah, thanks, Chair. I think that Rachel, and don't take the lack of questions as any aspect of this. I think we're all rather familiar now with the aspects of the last year's annual accounts and the concerns that we have and the ways the future concerns as well with all of this. So thanks, like Dave said, for what you've done here. And as I say, I think we're now. I don't think it's a meeting goes past now that we haven't got a lot of inference in reference to the financial situation and our concerns and our recovery plan and what we can do to mitigate it. So, but thanks very much. As I say, we're becoming more and more familiar with the issues here.
Thank you, David. In the absence of any, Dave, you coming back in again? Is this regarding recommendations?
Yeah, I was really going to say, so obviously there's a couple of recommendations there that we can kind of review right now. I think it would be helpful just to kind of touch on the how we kind of deal with the lack of an actual kind of document for members to look at today in terms of the actual accounts themselves.
Yeah.
What I was going to suggest and kind of up for the discussion would be so noting Rachel's comments around no significant changes from the unaudited version that members did see back in June, and the positive audit report that we've got. I was looking to see whether members would be content with if we can circulate the document electronically today. I can pick up with Arlene around getting that sent out. And if the voting members present today at least can come back and give their approval or otherwise in terms of the accounts, then we would kind of do it on that basis, and then we could report that back to probably, or maybe take kind of some feedback from Roger Many on this, but whether we can bring it back to the IGB to say that the PAC can approve these virtually or on today's date, and kind of just formally noting that was the position for governance. But I'll kind of happy to take any other comments, suggestions, and I don't know, Rachel, if there's anything you might want to kind of say about that particular process.
Thanks for coming. Sorry, my signal froze there, so I think you've suggested circulating the accounts electronically to members.
Yes.
Yes, yeah. If there were any concerns or queries that members had about the audited accounts, just to say I or one of my team could attend a further session if that was required to be scheduled. And if you're proposing to you take it to the IGB full board meeting for that to be essentially formally signed off on the board date.
So my suggestion, Rachel, would be that they are virtually signed off with circulation. So ask members to confirm their approval virtually, and then at the next day, so that would then become the date that we would then say that they're signed off. But for governance purposes, at the next IGB, so next month, we would confirm that was the approach that had been taken, that we had signed them off virtually. But if you feel that's not an appropriate way to do it, then we can defer it until the December IGB, obviously acknowledging that then takes us into a later timescale for signing off the accounts, the official signing of the accounts themselves.
Thanks.
I was going to suggest, Dave, is that we can sign off the first 3 recommendations, presumably.
Yeah, so we can sign off because it's the audit report itself, that. So I'm just getting back to the top to see the recommendations.
So we can sign off 2.1, 2.2, and 2.3 because that's the documentation that we have.
Yes.
And then you can electronically circulate the annual accounts as an Appendix 3. And then we can get via return sign off. Yes?
That was my suggestion, yes. But however, I don't know if Rachel, if you've got any views on that you want to come in. So
thank you. I was just going to say, yes, I'm satisfied with that if members are comfortable with doing that, because it's for members to be satisfied that they've had an opportunity to read, scrutinise and ask questions on the accounts. And if it's not today, if it's a later date, all I would be asking for is that we'll obviously get the letter of representation signed at the date of the accounts. So we would have assurances at that point that nothing significant has changed between right now and whatever date the accounts are signed. So that would cover off the governance arrangements for us, and then the formal confirmation to the IJV meeting that that's taken place, and that would be all minuted. From my perspective, would satisfy the requirements. So it's for members now to decide if they're happy or if they're likely to have further questions on the accounts. Thank you.
Rachel, thank you. That's very helpful. Helen.
Yeah, just if it's helpful, I do know that other organisations do similar things online and use electronic signatures. So it's probably okay.
And Christine, do you want to come in?
Yeah, thanks. So apologies again for the oversight on this one. So yeah, so we will get the document circulated. I think it has actually been circulated during the meeting, but I appreciate that that nobody's really had time to have a look at it, and I wouldn't want to take up your time and distract you during the meeting to actually look at it. But we'll give you all a chance then to look at this and then come back and agree when I get the feedback in terms of agreement and get this signed off at an appropriate date, hopefully relatively quickly. And get back to Audit Scotland as well with the response.
Thank you. And I'm not seeing anything else that goes against that. So I think that's the feeling of the committee, Dave, that we proceed on the basis that we just outlined, that we can sign the rest off automatically. But we do want to try and keep to our timescales as much as possible. Thank you. And just as a highlight, and it was raised in the report itself, is there are consequences when we've got interim arrangements acting up for so long, because it impacts all the way down the line. So I well understand the pressures that are on staff in this instance. So and frankly, I'm surprised that we've done so well given the circumstances that we're actually in. So I just want to say that. Thank you so much. Okay, on that basis, we can approve the recommendations of 2.1, 2.2, 2.3, and the rest will be done, 2.4 and 2.5 will be done electronically, okay?
It's agreed, yeah.
Okay, thank you. And thank you very much, Rachel, greatly appreciate your input, and also we very much welcome the positive things you've said about our work. Thank you. Okay, we can now move on then. I wonder if we could have a quick comfort break, because I need to move around papers because this was a supplementary paper. So so we have a quick 5 minutes break, and we'll come back in that time. Okay, so see you soon.
Okay.
Okay, thanks very much. Welcome back. We have a quick change to the order of the agenda now, and I'd like you to look to the item 11. We brought this forward because Peter has time constraints today. Peter Allen, who will be presenting the paper, and he needs to weigh around about 11:15. So if you could quickly move to the City Plan for Dundee annual report for 23-24, which is item 11, and that is on page 217. Okay, and I'll just see if everyone's back in time. Okay, I think we seem to be.
Peter's on the call now, so.
Oh, that's grand.
Yeah.
Peter, thank you, and I'm glad that we're able to meet your timescales for today, and I hope we can at least give you a good 15 or 20 minutes maybe on this, if that's okay.
That'd be amazing. I'm sure it won't take that much of your time. Thanks for inviting me along. I'm Peter Allen. I'm the Community Planning Manager. I coordinate the Dundee Partnership, and the City Plan is the Dundee Partnership's Local Outcome Improvement Plan. I'll just take a couple of minutes just to introduce the plan. It has 3 big priorities which we focus on as a partnership. Those are child poverty and other inequalities, inclusive growth, and trying to achieve our net zero ambitions. The annual report's put together in a very specific way. We try and use a scorecard method where we try and demonstrate measurable progress towards our outcomes, and we do that and also describe the achievements that we've managed over the year. Because it's an annual report based on a 10-year plan, often those actions are relatively short term, but we hope that they demonstrate a reasonable progress towards our long-term outcomes. Although we would say that we understand that there are shortcomings with the measures that are available, and Sheila Allen from who works jointly with the Health and Social Care Partnership and the Council, she is leading a group which is trying to identify a much more effective way of measuring intermediate progress, so that we can be confident that the things we're doing in the short term in relation to these themes are actually taking us to where we want to be, especially in relation to inequalities. And I know that some members of Catherine's team are helping us with that. So we believe that the quality of the city plan will improve in the future if we're able to develop even more robust indicators of progress. The report is necessarily expansive because it covers everything that's in the city plan around those three themes. It does identify areas for improvement on pages 8 and 9. So we're trying to be really upfront about those indicators which are going in the wrong direction. And again, you'll see that those cover obvious areas of inequality around child poverty and employment, and the gaps that we're trying to close in the city. And it was interesting listening to the discussion about suicides levels, which is again another brutal evidence of inequality in the city. And I think that's primarily what we're trying to do in the city. We're trying to create an economy that satisfies that provides us with a context to be able to improve the well-being and financially and mentally of everybody who lives in the city. But we're conscious that we're far away from that, and that our child poverty and inequalities group focuses really deeply on the range of inequalities and the depth of inequalities in the city. And we know that the IJB is really aware of that and is one of the key partners in trying to help us to address those inequalities and to close them. So we think the city plan, the annual report, shows that we're taking these things seriously, that we're making some progress, but we know that we've got a long way to go, and especially in terms of the individual inequality outcomes for people who live in the city. Having said that, though, for many in the city, it's an amazing place to live, and we can enjoy outcomes as good as anywhere in Britain and some places in Europe because of the facilities and the place gives those who can afford it an amazing quality of life. So the city plan has to address both those truths, as it were. How great it can be for those who can afford it, and how difficult it can be for those who can't. So I'm happy to take any questions, but I'm sure the things that we cover in the city plan are all going to be very well known to you guys, and I'd like to thank you for the contribution that you make to the partnership and the work that we do.
Thank you so much, Peter. It's a very good and very comprehensive report. Questions for Peter, please. David.
Thanks, Peter. There's a few things in here in the report. As Bob said, it makes really interesting reading, and I really am enjoying reading these reports from I call for the coalface, because they're so informative to me, and as again being new at this. But just for clarity here, before we even get to the report, in the actual paper, I think it's page 217, it talks about one of the points highlighted is that 46% of 16 to 24-year-olds aren't economically active in Dundee. That's a staggering percentage. So does that include children in further education? I say children, people between 16 and 24. Does that include people who are at university, at college, still at high school, you know, being retained on to 5th and 6th in a high school, whatever? Because it's a huge percentage figure.
Yeah, I wouldn't have thought so. One of the areas that we do have to concentrate on in the city is in positive destinations for our young people, and then even more, almost more important than that, is the participation, the ongoing participation of young people. I think that for Dundee, we've always found it challenging to maximise the number of young people going into positive destinations, and even more challenging to help them to stay there. And we know that that's going to be an incredible source of inequality in the future if our young people start already with fewer opportunities. But I'm confident that the city plan and the work from the partners acknowledges that and challenges ourselves to improve our performance. But yeah, I think that's the outcomes for young people, especially those young people who've been in care or living in big families or living in areas of deprivation. We know that those are going to be challenging. But I know that Glenn's on the call, and Glenn will understand this area much better than I do.
Well, thanks very much indeed, David. And I think Glenn's just come in appropriately there. Glenn.
Perfect.
Thank you, Chair. And I don't know if it helps, David, but the Council has just recently completed a review of its approach towards what we call youth participation or positive destinations. And from that, we've developed quite a comprehensive delivery plan covering 8 different areas. And the work starts within school with a more proactive approach towards identifying those who are at risk of not going into a positive destination after they leave school. And they're running alongside that a range of other actions, for instance, extending mentoring support to children after they leave school, as well as when they're in school, and also working with prospective employers to explore the extent to which they can offer more flexible opportunities for some children and young people who might struggle with the standard 9 to 5, Monday to Friday schedule that we're all familiar with. So there's a range of actions, and actually the most recent data in relation to youth participation shows that, unlike most other areas across Scotland, Dundee has moved in the right direction, but obviously we're conscious that we need to sustain that. And just picking up on Peter's point about sustainability in relation to care experienced children and people, because again, the trend is moving in the right direction, but they do struggle after around 3 to 6 months to remain in a positive destination. So again, we're doing a lot of work in relation to that as well, not least with our through care and aftercare team. So it is a priority, but there is a lot of work going on in the background in relation to this.
Yeah, thanks, Glenn. I just find it really concerning if it's such a high figure that I thought there must be something else behind this. You know, that if we're actually saying that those who do have a positive destination, and by that I mean either are going to apprenticeships or are going into whatever form of work or going into further education, be it college, university, if they're excluded from that and there's still 46% left, what sort of message is that to youth in the final years at school, that 1 in 2 of them will not get a positive destination? I think I'm totally unaware of a figure like of that high nature. I think that's, I can see what you mean, Peter, and there, if you've got a figure of that level, then it's just starting them off on the wrong footing as far as inequality, and how do they better themselves effectively with that, you know. And sorry, I'm staggered by that. The second question I had, if you don't mind, Bob, was down on I think it's in page 238 of all the papers, when you're talking about living wage, Peter, in the city plan, and it's just interested here. You know, Dundee obviously have declared the commitment to that. Understand that, and it mentioned, I think you have to. We've also read this report, but I wrote a note saying there are 128. I think it was employers. I think at one point who'd signed up to that. Bearing in mind there's the public sector and in the private sector, and the private sector, a number, particularly the bulk of them are small employers, and living wage is not always capable of that. So I'm quite keen of that 120 to find out of that 128 employers, do we have an idea of a ratio between public sector and private sector? Because I suspect the bulk of them are public sector.
Well, the number of public sector organisations is relatively small compared to the number of smaller organisations in the city. I mean, we're really chuffed that the big public sector organisations have joined in. So they have a big impact and they have big numbers.
Yeah.
But the majority of our members are those smaller companies who think it's now the message that we're getting is that they are finding it increasingly difficult to meet the living wage, and on one level we don't apologize for that, because the whole point, the basis for the calculation for the living wage is that that's what people need to be able to lead a reasonable life. So we're proud to represent that, but we also are now understanding the challenges that that's posing to businesses who might be really struggling with the same kinds of inflation and cost of living pressures that the individuals are. So I think we're trying to be a bit more balanced in our messaging around the living wage now, to say how important the wage is, but also how important it is that we understand the impact on businesses, because if the businesses go under, or it leads the businesses to create fewer jobs because they can't afford as many jobs, then that's detrimental too. We want as many living wage jobs as possible. And the other thing to bear in mind, though, is that the importance of the accreditation is not just the people that you employ, it's also the influence that we require you to have on your contractors and the other people who provide facilities and or services in the place that you work. So we're trying to create a network that spreads out from the employers through the contractors and reaches much further. And the other thing also to bear in mind is that the number of accredited organisations is tiny compared to the number of organisations who will be paying the living wage but aren't accredited. But we think the accreditation is a badge that says so much more and suggests that you're willing to make this bigger commitment. But we don't underestimate the impact on small businesses, not at all.
Thanks. Bob, so I'm going to put you on queuing up. Can I just make one observation as well, rather than a question here? Just again, moving through, because it's a long report and there's a lot of information in it. I think page 27 of your actual report, when we're talking about delivering inclusive economic growth, and you mention about it's looking at the number of visitors to Dundee. And it's just an observation, between 21, 22 post-COVID, that they have grown again and grown significantly with what Dundee is providing and offering now. And I see 23, 24, almost 1.4 million visitors. Why is the target for 2025 half of that? It's only saying 752,000 as being the target. It's just an observation. I think doesn't seem be realistic at all if you're already achieving 1.4 million.
Yeah, that's definitely one of the things that we have to revisit on a regular basis. If we're meeting targets, then we want to revise them. So I'm guessing that there'll be a significantly different target for the next version. Yeah.
I'll shut up now. Thanks very much for it. It was very interesting.
No, thank you, David. I think that just shows due diligence on this report, I would say. Thank you. Are there further questions? I just wanted to make a couple of observations, if I may, Peter, and one relates back to the youth unemployment between 16 and 24 was about 31.7, as I recall from the figures, and it struck me when looking further on about our own workforce, and only 10% of our social care workforce fit within that age range. Now, given that the bulk of our staff are increasingly in the over 50s, and social care is a very physically demanding role, there are implications for the retirements at one end and how we can increase our workforce at the younger end. So it strikes me as an opportunity there to focus much more on bringing people who are unemployed or economically inactive into that workforce by whatever means that we can find to do that. And that would strike me as a kind of fundamental foundation around helping to address some of the outputs from child poverty into that age group. I just think it's pretty fundamental to me that we get young people into jobs and become economically active in some way or another. Dave.
Yeah, thanks for that, Bob. That's a really helpful observation, and it's something that we are looking at in terms of the kind of future shape of the workforce as well. Unfortunately, the social care in particular doesn't seem to be a particularly attractive proposition for younger people. It's something that we kind of do try. We've kind of got, we continue to be present at things like recruitment fairs all over the city. The council in particular will always have a stall at kind of things like the school in the schools for recruitment fairs, etc. And we also have the partnership with Dundee and Angus College around the Social Care Academy as a potential option for people as well, which attracts people of all ages to that side of things too. So there are a number of things that we are continue to try and look to do around that. But I think that there's certainly untapped potential out there that we need to continue to push around.
Yeah, well, I think we'll come back to that issue then, Dave. Thank you. And I know that's an issue for NHS Tayside as well in terms of these same matters. Glyn.
Apologies, Chair. I think Dave covered what I was going to say, but it chimes with that point I made earlier about flexible opportunities and being more proactive in that space.
Thank you very much. And just one other observation is about the, I think, increasing number of emergency admissions to hospitals, and particularly mental health. And again, I'm thinking again about the prevention agenda, is that once people come into the hospital system, it's very difficult to often get them back out of the hospital system again. And we do excellent work with delayed discharges, as you can see from the, I think, very positive stats across, not just here, but in Tayside generally. But there is something about why hospitals seem to be the first point of call. And I'm thinking that there's so much more work we can do upstream here. And it's not just about population health, it's about our systems that are tracking people who may be vulnerable earlier on.
Yeah, the prevention agenda, it comes in cycles, and we gave it quite a bit of attention a few years ago in the partnership, and I think it's due for another look. And I've been encouraged to do that by a member of Catherine's team, Vered, on behalf of the ADP. They've asked us to have another look at how we can be doing much more of the work that you're describing, Bob. So I'm looking forward to working with Vered and people across the partnership to have another look at how we can be going more upstream. We have a pretty good understanding of what is it we want to do that's different in Dundee. I suspect that what's happened is that the depth of the crisis that we seem to be facing in all our services is pulling us towards people who are already have really negative outcomes. But if we're ever going to turn it around, we agree that we need to be much more preventative.
Thank you. And with that, I'm going to draw it to close. And Dave, do you want any final comment?
It was really just to add to what Peter was saying there. I absolutely agree with that around the preventative side of things. I mean, you'll know from the information we've kind of provided to this committee and the IGB previously that the number of mental health referrals and presentations are significantly higher and continue to climb. Significantly higher since the pandemic, and continue to climb. We've also got some. So there are some kind of services that we're putting in place to try and mitigate against that. The main one be around Hope Point, which is kind of referenced within this report as well, and that sort of kind of crisis intervention kind of element, which is designed to stop people, either going towards a kind of hospital setting or worse, not even kind of making it to a hospital, such as the kind of mental health concerns that they have. So I absolutely agree with you in terms of that. There's still something we need to kind of focus as much as we can in terms of the prevention agenda.
Thank you very much indeed, and thank you, Peter, for your the city plan document. Thank you. And we note the recommendations in 2122 and 23. I won't read them, they're quite lengthy, but thank you very much indeed. And I hope you feel as if we've had a good go at your report. Thank you very much indeed, Peter. Thank you. Okay, then, that means we need to swiftly track back to page 103, which is item 6, Dundee Health and Social Care Partnership Performance Report 24-25 Q1, and Shahida Naeen. Shahida, welcome.
Thank you. Yeah, so I'm delivering reporting on the Q1 performance report. So the purpose of this report is to give the key messages on the performance of the national indicators, the MSG indicators, and the social work demand data. So most of the indicators are for the rolling year, July 2023 to June 2024. So the baseline has changed compared to previous reporting. So it's changed to 2019-20. So the duty under legislation is to compare the last 5 years. So please be aware when comparing this with previous reports. And also be aware that 2019-20 reporting year will be affected by the pandemic. For the key messages in the data, it's worth noting that there are variations in inequalities amongst the 8 localities in Dundee. So emergency admissions has increased by just over 15%, with every LCPP showing an increase. The highest increase was in the Ferry and the lowest was in the East End. So looking at the current data for the current year, half of the localities were worse than Dundee per 100,000 population and half were better. Emergency bed day rate has also increased by just under 5% in comparison to the base year. However, Coleside and Maryfield are showing an improvement. North East was the locality with the worst performance. So comparing the performance to the current year for Dundee, 3 of the localities had better performance and 5 were worst. The 28-day readmission rate per 1,000 populations has increased by 7% in comparison to the baseline. East End was the only locality to show a decrease and improvement. Maryfield had the highest increase of 18%. So comparing the localities for the current reporting year of 150 admissions per 1,000 population, half the localities had better performance and half had worse. Hospital admissions due to fall for over 65s have increased by 16% when compared to the baseline year. Coleside was the only locality with a decrease or improvement. The highest increase was in Maryfield. The Dundee rate was 35 falls per 1,000 population over 65, and two of the localities were higher than this, and that was Lochie and Maryfield. So for delayed discharge, both the indicators are showing an improvement for standard and Code 9 delays. But please note for Code 9 delays, we're talking about small numbers, so there's a greater variation in the percentages. So Lochie and East End show an increase. They're the only ones that are not doing as well in the delayed discharge for Code 9 and standard delays when compared to the 2019-20 baseline year and when compared to Dundee. So going to the social care demand data, this is based on a snapshot data for 23rd of September 2024. So on that date, no people were waiting in hospital for an assessment, but 131 people were waiting in the community for an assessment. And although people are waiting for an assessment, it doesn't mean they're not receiving a service. In the majority of the cases, they will be getting a service, but just waiting for the assessment. So 5 people were assessed and waiting for a care at home package in a hospital, and that was 64 hours to be provided. 8 people were waiting in the community, and that's 52 hours to be provided. And for those that are already in receipt of a care at home package, 14 additional hours were required and not yet provided. Also, just to update you that we have updated indicator 10. That's a percentage of staff who say they would recommend the workplace as a good place to work. So although data is not available on this nationally, we have used iMatter data for health and social care staff, and 76% of the staff say they would recommend their organisation as a good place to work. And this is, the iMatters is based on a response rate of 54%. And finally, there's an update on indicator 17, which is a percentage of care services graded good or better. And that's been updated since the last time we reported. So in 2023-24, 77.5% graded the services as good or better. And this is a decline from 5 years ago.
Okay, thank you very much indeed. Any questions for Shahida, please? Can I just ask a question while I'm waiting for anyone else to come in, Shahida? There is a clear separation between some of the figures for emergency admissions for people who are in care situations or in inpatient facilities. There's a clear separation between your figures for this and folk already in clinical care? They're clearly separated.
Just wondering if anyone, do you mean that there's a...
If you're in the care home, for example, and if you have a fall, would that be recorded here, or is that a separate, is that regarded as something different, for example?
I think it is included, but Lindsay's come on.
Sure.
Because I'm aware there's another report later on the agenda where we're looking at clinical care issues. And I just wondered, Lindsay, do you want to come and clarify for us, please? Thank you.
That's great, thank you. Then I'll pass on to Lynn because I see her hand is up. So where a person falls in a care home and is admitted to hospital as a result of a fall, they will be included in these figures, as well as if they are included, they're also included in the emergency admissions and bed days data as well. So institutional settings are included in these figures.
Thank you. But that's quite different from, say, a hospital facility. That's included elsewhere.
Sorry, I'm not understanding. If they're coded as an emergency,
from people that are living in community situations, as opposed to people who are already in, because there's another reporting for people already in hospital situations where you would expect to see large numbers of falls and things like that. I'm just trying to get that separation into two, and that we're not double reporting. That's all.
That's correct.
Okay, that's fine. Lynn, thank you.
Yeah, it was just to say that actually our care home admissions to hospital in Dundee are very low against the national average, and that is reported separately elsewhere, and largely due to the types of urgent community care support that we have that provides a great deal of support to care homes. So it is all incorporated into the one data set, but actually it's not extrapolated in this report, but we perform extremely well against the national benchmarking.
That's really helpful, actually. And this is my first session as chairing this committee, so you'll forgive me if I'm asking the daft questions. Thank you. Another part that came up for me in this report was the increased trend of 18+ emergency admissions. What do we know about the background to this? What's that about?
Do you want to come in on that point, Angie?
Angie.
Apologies, I was still coming in on the last point. There is a very small potential for a double count with the falls admissions, because I just recently found out that if somebody's in Royal Victoria Hospital and has a fall, they're blue lighted to 9 wells, but the numbers would be so small that I don't think it would significantly impact the data. but Lynn may be able to clarify that one. Apologies. In terms of the increases in over 18s, I don't have any specific data. I think anecdotally we are seeing trends in multiple people having a deterioration in condition. They're people who otherwise have generally healthy prior to the pandemic are no longer healthy. There's a lot of things that are impacting on the admission rates.
Right, thank you. I know I'm opening a can of worms here in terms of this question, but it's one that I think, you know, and even from reading the last report as well, you know, it seemed to be trends here that I noticed. It's as if hospitals seem to be the first point of call for many people, and I wonder if that's, I know it isn't sustainable, it's what are the alternatives? Lynn, and then Lindsay.
Yeah, just to agree with Angie's point. I mean, this is anecdotal, but sort of an educated anecdotal, if you like, that we are seeing increased admissions. We know that there are well-recognised issues around primary care and primary care's ability to cope with demand. We are conducting day of care audits within the emergency department to look at why someone decided to present to A&E and what those patterns are. There is a work stream identified through our urgent and unscheduled care board to try to address that and to redirect people wherever possible. But the issues that primary care and community services are experiencing is probably well documented elsewhere and is certainly having an impact on inappropriate presentations at ED. The other thing I suppose I would say is that in some ways using the 2019 to 20 as a benchmark is probably beginning to be quite troublesome, because that's pre-pandemic, and what we know is that the presentation of our population now is hugely significantly more frail and deteriorated, probably as a result of the pandemic. So we're not really measuring, you know, we're not really comparing apples and pears here. So actually,
are we still duty bound to report from that period by government?
Yeah, Lindsay's nodding her head, yes, but I think we need to understand that benchmarking line is probably slightly less helpful than it once was, given what's happened in the last 4 years.
Right, thank you. That's helpful. Lindsay.
Thank you very much. Yep, agree. We do have a legislative duty to report the previous 5 years' data, and until Q4 2023-24, we were continuing using the start of integration baseline, but following discussion at the PAC, we agreed to bring that forward to the previous 5 years from the current reporting year. We did have the discussion at PAC that actually, as we come into the COVID pandemic urgent measures period for hospitals, when hospitals were emptied, that is going to have an impact on how we compare our current performance with the baseline. So everything that Lynn has said, I absolutely agree. And in addition to that, for Q1 of the baseline year was when the pandemic urgent measures started, therefore bringing that year's rate down. So when we're comparing the current performance with the baseline year, there's going to be an understandable difference, greater than it would have been if there wasn't the pandemic. So it's that, looking at that with that caveat, but also understanding that for Q2's performance, when we come to the next PAC, that's going to be even more apparent to you. And you might want to have that discussion and make that a decision that we perhaps look at the 2018-19 baseline going forward until we get through the sort of the pandemic years for baseline reporting.
Thank you. Well, I'm glad I asked the question there. Dave, you can update me in due course on where we want to go with that reporting, but thanks very much indeed. I found the reports really helpful. Are there any further questions for Shahida, please? Thank you very much, Shahida. and we note the recommendations under 2.1, 2.2, 2.3 and 2.4. So we note all of these. Thank you so much indeed. Thank you. Okay then, that now takes us to item 7, Dundee Health Social Care Partnership, Clinical Care and Professional Governance Assurance Report, and that's on page 125. And Matthew Kendall's going to introduce this report. Matthew.
Thank you, Chair. I'm Matthew Kendall. I'm the Allied Health Professions Lead and lead on governance for the partnership. Presenting the report today, I'm offering an assurance level of reasonable, and that's outlined in section 2.2 with the bullet points that are listed in there. I've just got 3 elements to raise to the committee's attention. The first is in the risk profile section, section 4.1. Our risk profile over the 12 months is slowly reducing. We've reduced from 44 risks, service risks in the partnership to 37. And you'll note that the level of the risks, the highest risk that we've got in this section is now 16, and that drops to 12. And in the last few months, we've had risks at level 25 and 20 within this section. So our risk profile is reducing. A still significant number. The key areas that we have ongoing risks for the number of risks is in around workforce and in around our buildings and our infrastructure. We have implemented a risk management group that supports the work of our clinical professional governance, and this is having positive effects in supporting managers contemporary management of those risks. We do have a new risk which is still identified in the paper as a pending risk, but that will be a current risk now. This is in our psychological therapies, and it's a breach of referral to treatment standards, which is a government standard that's set. The standard being 90% of people will meet the return to treatment, so referral to treatment standard of 18 weeks. Within Dundee, we're currently sitting at 72%. So we've been put under enhanced support measures with the Scottish Government, along with a number of other partnership areas. Our acting director has developed an action plan. She's been working with the Scottish Government to address this, and she will work with the Scottish Government to implement that. Some of the early benchmarking work that was done around this process identified that certainly within Tayside, because this is a hosted service and operates across Tayside, the demand is exceptionally high for the population that we have, and the resource that we've got to manage that is comparatively lower compared with some of the other partnership areas. So the team certainly report that they feel that they've got quite good, efficient and effective measures for managing their work. But obviously, we want that standard to improve from the 72% position. And the last thing that I was going to raise, which is a little bit further down on the report, I think it's page 143 of the report, and it's under the learning from complaints section. And it's just to note that we've had a number of complaints coming through about access to weight management drugs, which has been in the news as well sort of recently. And the Scottish Government has been working with a short life working group and all of the health boards to support the development of pathways for access to these drugs. The short life working group in the government was needed because there were some concerns about a number of health boards' ability to implement the recommendations that they've made. There were certainly some concerns about the supply issues for the drugs, and also there was uncertainty about the real world take-up rate, which would make service and financial planning challenging around that. We have implemented a short life working group within NHS Tayside, which is led by our dietetic consultant in public health, so we expect to see movement on that fairly soon. They're just the key points that I wanted to raise, but I'm happy to answer any queries or questions that people might have.
Thank you very much indeed, Matthew. It's quite a detailed report. So any questions, please? And if you could comment also in your questions about the level of assurance, which is presented as reasonable. Can you comment on that as well? Thank you. David.
Yeah, thanks, Bob. I have no concern with the level of assurance as what's been recommended here. I think the only mine was more observation. There was a lot of data in this, but I think I was picking up again on the, I think as you're referring to, Matthew, in your area on risks and things, about the impact in primary care sustainability and the Strategic Risk 1374 and the GP practices and the pressure on them and the need to remove the overhead costs there for sustainability. I think that's again is something we're hearing from other reports as well and other areas and discussions. So that's noted. But the rest of the report, no, I've got nothing more to add to that. Thanks.
Thank you.
Thank you, David. A question for me, Dave. Does this report go to the Clinical Governance Committee in NHS Tayside? It does.
Yeah, but Matthew, I'll let Matthew come in on that. But yeah.
Yeah, absolutely. It's the same content within the report, but we format them slightly differently for the different groups. But yeah, I present that report there, and this report will be presented on the 3rd of December.
Thank you very much indeed. That's really helpful. I see no more questions, so I'm content to move to the recommendations that are set out within the report, and the level of assurance provided is reasonable, and I think that's a reasonable assumption given the information we have in the report. So we accept the recommendations. Thank you.
Thank you.
Thank you very much, Matthew. That now takes us to item 8, which is the quarterly feedback report, second quarter. And that is being presented by Claire Lewis-Robertson. Claire.
So I think you're used to this report. There's been a slight decrease in complaints received across for both health and the social care complaints in the second quarter. There's been a slight increase in the average days to respond for health reports, but a slight decrease for social care and social work. We're really focusing on completing complaints within timescales, and for the stage 1 complaints, 90% of health complaints were closed within timescales, which is really impressive. Only 33% for social care complaints, but they're very small numbers for them, so slightly disproportionate. But when we move into the stage 2 complaints, which are generally the more complex complaints, that for health complaints, that's just down to just under half done within timescales. But we are working very closely with the complaints and feedback team, and we've worked to ensure that our complaints coordinator has access to the systems that she needs to, that will make it easier to manage. Planned service improvements, just to note that when we do uphold a complaint, we identify the issues that were the cause, and we identify improvements to try and prevent these from happening again. Open complaints, a snapshot. This was kind of, I think, at the end of when we put that in, but the open complaints were kind of 16 for health and 7 for social work, and you can see the time scales. So there's one in social work that's kind of very long, so we'll be following that up, but I think that is a very complex complaint, and the person is the complaint investigator is in regular contact with the complainant. Yeah, and as you can see, the snapshot of open complaints for mental health has got the largest one, which is kind of like the ongoing pattern. And care opinion, we're still rolling out the training for care opinion, and that's going really well received. Teams are desperate to get going with it, so yeah, that's just going really well. So I suppose people will be using that. The public can use that already, but the teams will have their own accounts kind of set up probably from January now. And that is our complaints and feedback report.
Thank you very much indeed, and welcome questions on this. Well, I think you're getting off lightly today, Claire. I'm just going to ask you, Claire, how long has care opinion been utilised by the Health and Social Care Partnership?
sorry, well, we're rolling out the training,
Right.
so that it's the public can use it now and put in a story, and it will find us. But the active tree of all the teams that we have within the Health and Social Care Partnership, that will be up probably January now. And so that means that teams will be actively using it in different way. But yeah, so, and then we have the contract, I think it was for 3 years.
Excellent. No, I'm just, I've seen very positive things come out of Care Opinion from other IJVs, and not least being the quality of the responses from operational staff to some of the queries has been less of an adversarial position to one more of people actually having to address strengths or weaknesses. And it's really, it adds another level of quality to the whole complaints process. Yeah. Thank you. And I see Angela Smith wants to come in. Angela.
Thank you, Chair. Yeah, it was just to add that there's 2 teams or services within the partnership that have been doing a pilot with Care Opinion. So we managed to get temporary access to the NHS contract to trial it before we fed into the recommendation to purchase, and it has been really, really successful. We haven't been collating the information in the same way because it wasn't a full license, but it's been really helpful in getting some both positive and constructive feedback.
That's really helpful, and I would suggest for a future development session, perhaps another year or so, is that we see how that's being implemented. Maybe have a presentation from Care Opinion Group themselves. Actually, I've always found it to be quite edifying in terms of the services that we're running. So that's my suggestion anyway. Thank you so much indeed, Claire. Thank you. And I believe that you're now going to do the next item 9. So we accept the recommendations and note what's within Claire's report. Thank you. Now, item 9, Claire, is on Dundee Health and Social Care Partnership Strategic Risk Register update.
Yes, so for our strategic risk register update, we've currently got 6 risks which score at 20 or 25, which are the highest risk categories that we have. These are the 3 risks which are a maximum of 25 are staff resource, lack of capital investment in health and social care, integrated community facilities, including primary care, and unable to maintain IJV spend. I think you're aware of these risks. They've been on the risk register for quite some time, but the updates, the latest updates that we have around them. Just I've identified the risks that we have and gone through them, giving the latest updates. They've all been updated recently. We have a new risk of information governance, and this is around capacity of staff to respond to subject access requests within timescale for council-owned data. So we have a control factor around that. It includes the identification of new posts within strategic services to undertake this work. We've recently archived 3 risks, and these are the Dundee Drug and Alcohol Recovery Service, which is a standalone risk, strategic risk, mental health services, and the implementation of safe staffing. And we consider these risks to now be considered as operational risks. And as you saw in Matthew's report, they are covered there and recorded and reported through clinical care and professional governance forums. Any remaining risks within those services that are strategic are included, we feel are included in other strategic risks such as staff resource. So it's not to say those areas aren't experiencing strategic risk, but those risks are covered within the other risks that we have within our strategic risk register. I think that's the highlights of what I'd like to, yeah.
Yeah, thank you very much. I think the report is clear and speaks for itself. Thank you. Any questions for Claire, please? Okay, I don't see any questions, so I'll just move to accept the recommendations. There are 4 recommendations, so we will note these. Thank you very much indeed. Thank you, Claire. And then that now takes us on to the Chief Social Work Officer Annual Report, Glyn, welcome.
Thank you. Thank you, Chair. And this then is the annual Chief Social Work Officer report for 2023 to 24. As you'll have seen, it overlaps with a number of other reports that have been presented today, not least the Protecting People annual report that Elaine presented earlier on, and in fact the City Plan report that Peter presented, and even the report we've just heard on the risk register from Claire. But there is a specific focus on social work and social care services, and it covers the period when Diane McCulloch was the Chief Social Work Officer before she retired in February this year. As context, a copy has now been sent to Scottish Government as requested by them. They in turn send a copy of all 32 reports to IRIS to carry out an analysis of themes, and then Scottish Government will produce an aggregate report early next year. And a copy of the report was presented as well to the City Governance Committee, the Council City Governance Committee on Monday, where it was approved. In terms of the content, you'll see on page 180 that across services, across children's, justice and adult services over the year, there are a range of achievements, not least in relation to some national awards, MAT standards, and as has been mentioned today, delayed discharge. There are still some real uncertainties in the environment. The National Care Service is still, as yet, extremely uncertain, shall we say. National Social Work Agency, there's a current Care Inspectorate thematic review of social work governance arrangements, and as we all know, a lot of uncertainty in terms of the funding of services. Some real challenges as well. The report highlights some real challenges in terms of workforce recruitment, retention, absence, early years, and some adult care homes, not all adult care homes, but certainly some adult care homes on the basis of inspection grades. And the report also outlines priorities going forwards, general across all three service areas and service specific as well. So there's a focus, for instance, on early years, on the prison population, and for instance on the Adult Support and Protection Improvement Plan. I'll stop there, Chair. I'm conscious there may well be some questions. If there are questions, I'll do my best to answer them, but I know that Dave as Chief Officer and Catherine is here as well, and obviously Angie and others as well. So if there are any questions, then we'll do our best to answer them.
And thank you very much, and the report speaks for itself. Thank you so much, Glyn. Questions for Glyn and others? Thank you. Not seeing any. Well, I was going to ask, and it appears in a number of reports, and that's about absence review learning. And in particular, we know there are quite high levels of social care absences within our workforce. That is a key issue of concern for me looking ahead. It's too high, and do we understand much more about why that is so, and at what point do we actually get involved? At what stage of absence management do we actually get involved? I suppose the question then, if anyone can help me here.
Oh, thank you, Chair. I can start, and I can see Angie's put her hand up as well. We know there are high levels, not just in fact across adult social work and social care services, but also across children's social work and social care, and also that a higher proportion of those levels relate to long-term absences, and a high proportion than normal of those relate to mental health problems as well, depression, anxiety, etc. So we're aware of that. We have a range of measures in place already, as outlined in the report. Angie can provide some more detail, perhaps, Angie, in relation to how we're applying those measures and the impact that's having, and also plans going forward as well, because there are further plans, Chair, going forward as well.
Thank you, Glyn. And Angie.
Thank you, Chair. Yeah, the realities within social care is that 50% of our staff are over 50. Very many of them all have their own underlying health conditions, some of them almost as complex as the people that they're actually supporting. We've also seen some peaks with staff who are having problems with finances, bereavements. The main cause of absences is stress, anxiety, other mental health conditions. but not very few of them. I think there was only one at the last check across the whole of social care that was work related. The rest was all personal circumstances. The next category is the musculoskeletal injuries, which again, within a workforce of over 50, is to be expected in quite a manual role. We have done carried out focus groups. Unfortunately, there was very poor uptake of those focus groups. And the only output that we've had from that is that the absence processes that we have don't actually help. If anything, they add pressure to the staff member. We're trying to look into that because it should be a supportive process. We are quite robust in how we follow that. There are 3-month monitors, 6-month monitors, 12-month monitors, final opportunities to improve. But there's supports built in at every single stage of that to make sure that we are trying to be as flexible as we can with staff. We regularly amend hours, duties, make sure we have appropriate equipment for staff. We regularly use occupational health referrals. What we're being told, though, is we have an ageing workforce and this is not going to change. Having said that, the latest data is that we do appear to have finally peaked with the absence levels around April, May of this year, and it is starting to slowly come down, but it's very hesitant and it is very slow. So we're hoping we've turned that corner post-pandemic and starting to head back into a more natural sort of absence levels.
Thank you. So we already do a lot of work on value-based reflective practice, for example, or trauma-informed practice.
Yeah, there's a lot of trauma-informed work built in, but our supervision for social care staff and social work staff is sort of 3-pronged. So you have continuous professional development to make sure people have the right training. We have the management element, but we also have that reflective discussion support mechanism. So it is a very supportive process that we have in place.
Okay, thank you, Angie. Thank you. Well, I'm sure we'll reflect on this further as we see further reports coming up. I thank you very much indeed. And Glenn, I see no further questions on this report, so I'm content to move towards the recommendations and note these. And thank you very much indeed. And just thank you so much for all the work that yourself and staff do to support this work. I really appreciate it. Thank you.
Thank you, Joe. I'll share that with the teams.
Thank you.
Thank you.
Okay, that now takes us on to item at 12, Governance Action Plan Progress Report, and Catherine Sharp. Thank you, Catherine.
Hi, Bob. Thanks for that. I'll just give a very quick overview of the paper because I think it's reasonably self-explanatory, and Claire's also going to support with questions because she is the woman in the know about all of the detail that sits behind all of this. So at the last Performance and Audit Committee, we advised that we had completed work with audit colleagues to reprioritise all of the historic actions that had sat within the Governance Action Plan. But we still had further work to do to be able to kind of present that to you as an overview, which we are now doing today. So Claire has completed all the work that was required to upload all of the reprioritised actions into our IdeaGen system, so that we could provide this kind of status update report to you. So appreciate that this is a very detailed report, but in the interest of openness and transparency, I think we felt it was important that you saw the detail in terms of all the work that had gone on, including those actions that we've now marked as being completed. There's 17 of those, 7 that we have abandoned because their relevance they're basically no longer relevant, or they're not achievable by the IGB as well, and we've provided some context around that in the appendix. And then the 29 remaining actions that will sit within the plan and that we will now report to you around moving forward. And those, you'll be glad to know that those reports moving forward will not have quite as much detail in them, so they should be a bit shorter and a bit more concise for you. But at this point, we felt you needed to kind of get that overview to be able to scrutinise the work that's been done. So all of that detail is in the appendix, obviously particularly the justification for the ones that have been abandoned. And we hope that after today, we will now be able to move into a regular reporting pattern at Performance and Audit Committee, where we'll update on the status of those 29 ongoing actions. There's a few of those that we hope to close off in the next wee while. So for example, we know that the review of the PAC terms of reference that goes back to the IGB in December will close one off as well. So there'll be a few that will fall off, we hope, in the next few months as well, and then we'll continue to progress the other actions. Claire, is there anything you want to add?
No, just that we have in the coding that you can see in the appendix that we have got that kind of coding to say there's IA and so internal audit, and there's also EA for external audit as well. So you can see from that coding that we have on the IdeaGen that's kind of a view for you where they've come from. But yeah, the information on IdeaGen, used to be called Pentana, is much more detailed. So we've got the kind of clear audit of where that information has come from. Does that help?
Okay, and well, we'll soon find out whether it does or not. Thank you. Any comments on this report, please? It is quite lengthy and quite detailed. David.
Yeah, thanks, Bob. I think the only kind of thing I picked up on, I think, was because, like you say, it was very detailed, particularly the appendix, and starting to go through and try to note, and then finding that quite a lot in, I think it's primarily in the finance and performance group, that the explanations were the same across a number of areas. And because naturally I started to look at things that were only down as showing it's 5% performance to date. And I recognise that these are being picked up on, and from all of this you're saying, Catherine, they're going to be added to that. It's just purely a comment, but just to let you know that I had read through a lot of it and was starting to get the same message. So yeah, fine other than that. Thank you.
Dave.
Yeah, so just comment on a comment here, because obviously there is quite a lot in the appendix, and we kind of felt it was important that at this stage, it's almost like kind of finishes off this next phase of the development of the governance action plan, or the review of the governance action plan. So we've basically put everything in there. Those that are 100% complete will then kind of disappear off of future ones, because we've done them. As well, and then as Claire was pointing out, in terms of the internal audit and external audit, kind of coding for that, we'll then kind of split them out into the kind of the respective elements for kind of review as well. And I think what you've described, David, in terms of some of the similarities of the response has been reflected in kind of how we've kind of got to the stage in the first place, because there were a lot of duplicate entries, if you like, duplicate kind of audit actions kind of over the years that have kind of come in, which is why one of the reasons why we were trying to unpack the governance action plan in the first place, because we recognised that there were so many kind of separate actions that actually were already being picked up elsewhere. So we'll continue to kind of refine that as we go through. But now we've got more of a manageable kind of number, if you like, of actions for us to kind of focus on. It does help that.
Okay.
David, is that a legacy hand there? Are you coming in again?
Apologies, yeah, it's legacy. Sorry, I'll get that down. There we go.
Okay, thank you very much. I don't have any further questions to it, but I think also I acknowledge there's quite a lot of complex information here, some of which overlaps. And it's almost as though, and I don't know if there's an answer to this, is that there's so many plans and frameworks referred to. It's difficult to see them across the piece as a committee for me. And I know it's always that looking for some kind of graphic representation of these and how they all come together. And it's a bit like, so because we're looking at everything from primary care to clinical care to finance, etc. It's very difficult to see through all of this in this kind of format. It's always, I would often find it helpful to see something, and so I can make connections between each one. But maybe that's an impossible ask. But I'll ask Catherine, she may have the answer.
Thanks, Bob. Yeah, I think we recognise that as well, and the need to just do a little bit of a stock take around suppose two elements: the plans and frameworks, but also a lot of the kind of strategic groups that support them. So the last strategic plan and advisory group, there was quite a lot of discussion about that, following on from almost like the next phase after the delivery plan. So we're about to do a little bit of work through the membership of that group to just do a bit of stock take, to set some of that out and potentially to rationalise some of that where it's needed as well, in terms of being really clear about best use of our resources. So I think that probably will, I like a picture too, so I think it probably will end up with us with a bit more of a graphic representation of how some of that fits together. I think there's some of us have that in our heads, but it would be really helpful to articulate in that in a way that can be shared more broadly, and we can make sure we've all got a shared understanding about that. So I don't think it's an unreasonable ask, but there's a bit of work to be done through the strategic plan and advisory group to get us there. So we'll certainly share that with you when it's available.
Well, I didn't think it was an immediate ask that was going to be
That's
satisfied, but but I thought again I'd raise the question. Thanks very much indeed, Catherine. So we accept a recommendation and we note the progress on the internal audit plan. Sorry, that's I'm looking at my next document now. So do we accept the recommendations within this action plan progress report? Sorry. Yes. So that then takes us on to item 13, which is the Integrated Joint Board Internal Audit Plan Progress Report. And that's a joint hand between Christine and Vary Hudson from Internal Audit. Welcome, Vary.
Thank you, and thank you, Chair.
Thanks.
Do you want me to do this, Christine, or?
Yeah, I was just going to introduce you anyway, just to say, yeah, this was our regular internal audit plan report. It's really good to see a lot of it. I've moved to green status on it in terms of either being on target or being complete. And I was going to just then hand over to Barry to pick up any key points that he wants to highlight.
Yeah, it's just a couple of points, just in relation to the one remaining review from the 23-24 audit plan, the DO6-24 workforce. This is it's now being issued in draft, and it's currently with officers for factual accuracy and completion of the audit recommendations within that report. And that report will be presented to the next meeting. We've also made reference to the external quality assessment of FTF internal audit that is currently ongoing. This is a requirement of the public sector internal audit standards, and it's something that needs to sort of be undertaken every 5 years. The assessor from the Institute of Internal Auditors has chosen a sample of officers and key contacts to speak to across the FTF client base. Just to let them inform you, for IGBs and Tayside, they've chosen to speak to Angus IGB officers. But I can assure the committee, once the work's completed, that the full report will be shared and presented to the pack. There was no other sort of relevant internal audit reports by Dundee City Council or NHS Tayside that required reporting to this meeting. I've nothing else to highlight from this report. Most of the work will be undertaken sort of later in the financial year.
Okay. Any questions for Vary or Christine, please? I don't see any questions. I think the report is fairly clear enough anyway. So the recommendations are to note the progress on the 23-24 internal audit plan and the work undertaken on the 24-25 plan. Okay, I think we're content with that. Thank you so much, Vary. And Vary, do you sit in all these meetings just as a matter of course?
Normally it's Jocelyn Lyle, the Chief Internal Auditor,
right,
would attend these meetings, but I have actually attended the last two. So it'd either be one of the two of us.
Well, we're grateful for your attendance. Thank you very much.
Thank you.
Okay, then that takes us for noting the attendance list. Is there anything that people want to observe or correct? Dave, do you want to make a final comment or something?
Yeah, it was just to note for Arlene that Vicky Irons as Chief Officer for the meeting today would then be no longer a member, and I think it's a shaded box that you take on that side of things. So just to kind of note that.
Okay. And that is that. The date of the next meeting, I think, Arlene, these are still to be circulated. Is that correct?
Yeah, the programme's still being worked on, Bob.
Right. If I could have early heads up on that, because diaries are really getting quite complicated these days. So I'd appreciate that. Thank you so much. Okay, thank you, everyone. I look forward to seeing you at the next meeting, which will soon be in about 3 months' time. And we'll catch up again. And thank you so much. And to all the officers, thank you so much for the amount and quality of the paperwork we got today, and for all the presenters. I just want to thank everyone. Thank you so much. And if I could have a quick discussion with Dave and Christine, that would be great at the end. Thank you very much.
Okay, thank you.
Thank you, Chair. Thank you.
Thank you, Chair.